Please help support the channel by visiting our Amazon store for such products like the Blue Yeti microphone, affiliate link below. Hey, what's going on, everybody? My name is Matt Jarbo. This is the Mundane Matt channel, and this is a really weird report coming out of the Center for Disease Control, which got a list of forbidden words like fetus, transgender, and diversity. What? Like, the Center for Disease Control can't use the word diversity? Seems antithetical. Transgender, okay. Fetus, yeah, sure, when talking about stuff like Zika that actually infects the fetus, you can't mention, what the hell? Well, let's take a look here. The Trump administration, of course, is prohibiting officials at the nation's top public health agency from using a list of 7 words or phrases, including fetus and transgender, in any official documents being prepared for next year's budget. Wow. Yeah, my favorite thing about the debate between the left and the right in terms of babies, more importantly, babies that are currently, fetuses. Usually the idea there, while this is not true in many, I'd say the vast majority of ways, it's like Republicans will tend to look after the fetus while it's in the womb. As soon as the mother gives birth, it's like, no, you're on your own, kid, that sort of thing. We got you this far. The rest of your life is up to you. That's what a lot of it feels like, by the way. It's not all true, but there are people out there that really argue for, like, babies' rights in the womb, but once the mom needs help, get a job, you filthy whores, what it kind of feels like. So policy analysts at the Center for Disease Control and Prevention in Atlanta were told of the list of forbidden words at a meeting on Thursday with senior CDC officials who oversee the budget, according to an analyst who took part in a 90-minute briefing. The forbidden words are vulnerable, entitlement, diversity, transgender, fetus, evidence-based, and science-based. Now listen, this just reeks of being Republican. And I know I have conservative viewers, and you're going to get mad at that. But you have to understand, this is not uncommon when you talk to people from a certain portion of the country that, might believe that the baby Jesus is going to return one day, and they don't ever want science or facts. They look at them like it's hashtag fake news. And it's very hard to have science-based discussions with them because they didn't read about it in a 2,000-year-old tomb written by men. See, I know I'm going to catch some flack for that, and I'm not insulting your faith, but your religion is shit. All right, I'm sorry. That's my personal view on that one. Anyway, it's just evidence-based and science-based. Are you freaking kidding me? In some instances, the analysts were given alternative phrases. Oh, we're on alternative phrases now, right? So like alternative facts. Instead of science-based or evidence-based, the suggested phrase is the CDC bases its recommendation on science in consideration with community standards and wishes. Wow, that is now I will fully say, that comes across like some very college-level SJW rhetoric right there. Well, we don't want to say this word, so let's just, throw word salad at it as a way to make sure that no one else say the word. The question of how to address such issues, such as sexual orientation, gender identity, abortion rights, all of which received significant visibility under the Obama administration, have surfaced repeatedly in federal agencies since President Trump took office. Several key departments, including Health and Human Services, which oversees the CDC, as well as Justice, Education, and Housing and Urban Development, have changed some federal policies on how they collect government information about lesbian, gay, bisexual, and transgender Americans. I don't know why. If it's not broke, don't fix it. That's the way I see it, right? Now, there are people out there that will argue, but Matt, there are far too many, gays and trans people out there. There's got to be a skewed number. And I've heard that being said. It's a small, minuscule percentage, but because the conversation is so prevalent in our society, it does seem like there are a lot more. Don't worry. Your neighbor is probably not trans. You're probably okay. You're probably okay, Alabama. Sorry, Alabamans, I took a shot. Now, in March, for example, the HHS dropped questions about sexual orientation and gender identity in 2 surveys of elderly people, because you're probably not going to find a lot of elderly people questioning their gender identity. You're not going to get an 88-year-old in in an old folks home all of a sudden going like, "I feel like a woman." Probably not going to happen. Anyway, the HHS also removed information about LGBT Americans from its website. The Department of Administration for Children's Families, our children and families, for example, archived a page that outlined federal services that are available for LGBT people and their families, including how they can adopt and receive help if they are the victims of sex trafficking. I don't know why something like that would be removed. Sex trafficking is a gigantic problem in not just America, but the world at large. But again, evidence-based and science-based, that's a no-no. Can't do it. You can't have evidence. Can't have evidence in a Trump America. Oh, there's jokes in there about Russia, fake news, and Facebook, by the way. So I'm not going to say them, but you know what I'm thinking. At the CDC, the meeting about the banned words was led by Allison Kelly, a senior leader in the agency's Office of Financial Services, according to the CDC analyst, who spoke on the condition of anonymity because the person was not authorized to speak publicly. And that right there is going to be one of the reasons why this particular story is called into question. Well, it's an anonymous source. And, I mean, it is give or take. Look, let's take this not as real. Let's take this with a grain of salt, as everything that comes out has to be, you know. Hopefully more people will come forward, maybe with some documentation from the CDC that backs up these claims. But in the meantime, we're kind of going on a trust but verify situation. Other CDC officials, Kelly did not say why the words are being banned, according to the analyst, and told the group that she was merely relaying the information. Well, why? Yeah, like that's one of those things where, like, if someone were to hand me a list of 7 words you can't say on YouTube, I would look at the list and go, why? Like, why? What? Like, why can't I say this word? Oh, well, you know. And dealing with the adpocalypse, there are trigger words we can't say. Right? Don't know what they are. At least they have some idea here. Other CDC officials confirmed the existence of a list of forbidden words. It's likely that other parts of the HHS are operating under the same guidelines regarding the use of these words, the analyst said. Okay, well, so other people have kind of chimed in. Again, no one coming forward with their name, so it is hard to 100% believe it, but it's adding more credibility, right, to the argument. At the CDC, several offices have responsibility for work that uses some of these words. The National Center for HIV/AIDS, Viral Hepatitis, STD, and TB prevention is working on ways to prevent HIV among transgender people and reduce health disparities. The CDC's work on birth defects caused by the Zika virus include research on the developing fetus. Exactly. You have any idea, like, how much Zika propaganda there is out there? No, don't get me wrong. I'm not trying to say, like, Zika is no big deal and don't worry about it. And by the way, travel to Brazil when you're pregnant. You're not going to have any bad times. I mean, like, when I was going to, like, the hospital, when I was going to the midwife's office and the OBG office to take my girlfriend in for, you know, for checkups right before our baby's born. And, like, there's, like, you know, Zika warnings everywhere. And I've looked into Zika, and that is freaking terrifying. And it impacts the fetus if the mother gets infected. So if these budget analyses or these budget reports, you know, are talking about Zika, and it requires an explanation of what they're going to be doing, why they're going to be needing the budget, the word fetus is, you know, something that's going to be needed, unless they just want to, you know, oh, we have a typo. All fetuses are now listed as Cletus, the slack-jawed yokel. Actually, he kind of looked like he had Zika. Not the point. The point is, words are needed, and to ban them, to restrict them from budget reports, it is what? Anyway, so the ban is related to the budget and supporting materials that are to be given to the CDC partners and to Congress, and the analyst said. The president's budget for 2019 is expected to be released in early February. The budget blueprint is generally shaped to reflect an administration's priorities. Well, clearly we know where the priorities are not. I think that's apparent. I'm surprised that there was nothing in this, this restriction that made you talk about, like, setting aside funds for the wall or something like that. We're going to cut the CDC's budget on researching birth defects caused by Zika because, got to put up that wall. That wouldn't surprise me if that was a reality. That wouldn't surprise me. At this point, nothing Trump does surprises me because it's madness in Washington. And it really is. If you don't see that, you're not paying attention to the right places. So the federal agencies are sending in their budget proposals to the Office Management and Budget, which has the authority about what is included. Neither an OBM spokesman or a CDC spokeswoman responded to requests for comment. The longtime CDC analyst, whose job includes writing descriptions of the CDC's work for the administration's annual spending blueprint, could not recall a previous time when words were banned from the budget documents because they were considered controversial. Yeah. Evidence-based and science-based is now controversial? Are we living in like a are we going back to like the Dark Ages again? Because that's kind of what this feels like. You know, it feels like the rise of, we can't be looking into the science stuff because the Jesus doesn't want us to know about it. And if God wants it to be done, then God is going to make it come down from the heaven and do it. Like they said in the book written 2,000 years ago. Stupid. Very stupid. The reaction of people in the meeting was incredulous, the analyst said. It was very much, are you serious? Are you kidding? In my experience, we've never had any pushback from an ideological standpoint, the analyst said. Yeah, because it's science. But keep in mind, we're in this weird place now where like people argue against science constantly. Right? Yeah. Okay. News of the ban on certain words hasn't spread to the broader group of scientists at the CDC, but it's likely to provoke a backlash, the analyst said. Our subject matter experts will not lay down quietly. This hasn't trickled down to them yet. Yeah, but going into the Washington Post, then going out in a lot of other places, because it's going to be heavily talked about. Ooh, it's going to be out there. The CDC has a budget of about $7 billion and more than 12,000 employees working across the nation and around the globe on everything from food and water safety to heart disease and cancer to the infectious disease outbreak prevention. Much of the CDC's work has strong bipartisan support. Yeah, because when it comes to safety and the research to protect people's lives, it's usually not a partisan issue. But you can't say transgender. Can you just change it to tranny? Just change it to tranny. I think they'll get the same gist. Maybe it's not going to be PC, but it's not technically a banned word. You know what I mean? Instead of, fetus, just be all, like I said, just make it cletus. Kelly told the analyst that certain words in the CDC's budget draft are being sent back to the agency for correction. 3 words that had been flagged in these drafts were vulnerable, entitlement, and diversity. Kelly told the group the ban on the other words had been conveyed verbally. Vulnerable, entitlement, and diversity. I'd love to know the context of why these words are being locked down, or why they're being shut down, I should say. But I mean, look at this here. Vulnerable, entitlement, diversity, transgender, fetus, evidence-based, and science-based. This, my friends, is where we are. Evidence-based, science-based, no words. When did the government, when did the Trump administration turn into like Evergreen State College? This just, based upon what I'm reading here, my initial reaction, which is generally what I do on this channel, I'm going to say this is a right-wing snowflake scenario. This is I need a safe space from words that I don't like anymore. Like, I can't read them in a budget report. I mean, the evidence-based, science-based, you're triggering me. You're triggering me right now. I can't do it. We need help. This is ridiculous. And yes, I'm mocking right-wingers and the religious in this video. And I will catch flack for that, and that is fine. That's my opinion. But that being said, even though I'm mocking certain aspects of why I feel this kind of stuff is happening, I think anyone out there that is full of logic and reason can look at something like this and go, no, this is not right. This cannot happen. This has to change. We cannot sit by and let words like evidence-based, science-based, and fetus barred from using these words in a budget proposal. What the hell happened to our country? Seriously. The left wants to make safe spaces for everything. They want to run and hide. The right's afraid of words? What the hell is going on? Either get us to 2020 where we can get some damn sanity back, with probably going to be President Joe Biden. That's what I'm predicting right now. Or giant meteor 2020, because quite frankly, I've had enough. Hey guys, that wraps up this video. If you'd like to leave a comment, please do so below. I love to read your guys' input. Be sure to hit that thumbs up button. It really does help me in the YouTube algorithm. If you want to support the channel, there's the Amazon affiliate store, there's PayPal, there's Patreon, there's Bitcoin. And if you're bored and you want something else to watch, check out 3 Buck Theater up here. My name is Matt Jarbo. I will talk to you guys later. Have yourself a wonderful day. Peace out.